And this Wednesday, the chair of the science department at Jackson College, Dr. Matthew Badtke. Good morning, Matt.
Good morning.
You getting ready to go back to work, get the next semester started?
Yep, our semester actually started yesterday for some classes, and then we'll have some additional late start classes going sort of in June, and then even a few more in July. Just trying to get as many opportunities as possible as students have interest in taking classes, or when they're finishing up at a four-year school, if they're interested in picking up some other classes this summer. We do have a lot of different opportunities.
It's pretty extraordinary. It's like having a class on hurricanes in the middle of a hurricane, and that's essentially what you're doing.
Right.
It's got to be difficult to create and then deliver a public health curriculum when we're in the middle of a public health crisis.
Right. I think it's exciting because there is so much interest, and students are going to have a lot of engagement in the material. But you're right that it is really challenging. One, because it's changing so fast, and there's new information every week coming out, and we're changing what we understand about the virus, about the disease, how it spreads, all those things. So it really makes it challenging, like you said, to try to kind of do it on the fly as it's all happening in front of us.
So what's new this week? What have we learned in the time since you were here last?
I think the biggest thing that's getting a lot of media coverage is the initial report from Moderna. They're one of the vaccine companies. They are experimenting with a new type of vaccine. It's never been tried before. Traditionally, our vaccines are made from taking whatever the organism is and inactivating it in some way, and then we use that as the vaccine. This is a very different approach. So what Moderna is doing is taking actually just some genetic material from the virus, basically, and using a different molecule to introduce that into the body. And so the idea is that, at least in theory, this would give a more robust immune response, delivering it through this mechanism, because you basically have our own cells then making the proteins that we're going to get the response to. But it's never been done before. And so that's one of the reasons why we really have to be cautious about, especially very early results like we heard this last week. It was promising. They had 8 individuals that they gave different doses to of the potential vaccine. They did seem to get an immune response that was on par with people that had recovered from the disease, which is really good. But that is not the same as saying that people are going to be protected from the disease. All we know right now is that it does seem to stimulate an immune response. We do seem to get antibodies developed in people that have received the vaccine. Whether that actually will lead to protection is an entirely different question, and that we do not have an answer to yet. So while people are wanting to get really excited about this, and there's a lot of interest in it, we really have to be cautious until we actually get some results where we have tested whether people are protected from the virus itself. That's really what it's going to take before we can start to say, yes, this might actually have a chance of working.
So would people that are in the test that have been vaccinated be exposed then to the live virus? Are there people?
Well, not intentionally, but that's the next phase then. So after they did this initial test and it seemed that there weren't any side effects that were too significant. They didn't actually report what the side effects were yet, so we still have to wait to see. But they said that there was nothing that seemed to be too significant from a side effect standpoint, so that's good. But what's next is then we go to a larger group of people, and these studies are underway, so it's not like we're going to have to wait a very long time, but I think it's going to be another couple months before we really start to see data where we have people that are just being exposed just from being out. You have a large enough group of people, no one's intentionally exposed, but just by being out in public, we can hopefully see the difference between people that have actually gotten the vaccine and those that haven't. That's the goal.
And we're seeing some tests that are saying 17 days as far as being able to spread the virus. Is there has there been any testing shown that with the severity of the virus, you're more apt to spread it for longer?
That does seem to be what there was some new data that came out this last week that seemed to suggest that we have quite a bit longer period of time of shedding than maybe people would have realized. So usually even after the disease has started to run its course and people are feeling better, you still have the ability to be shedding virus. And it doesn't really seem to depend on whether, people that are asymptomatic still are going to have some shedding. But there does seem to be a link between the severity of the disease and the amount of virus that person is able to spread. So somebody that is really sick, that has a much more severe form of the disease, is probably going to be able to shed more virus. So again, just more reason that we need to make sure that especially people that have any symptoms at all really need to be isolating themselves, self-quarantining, and then even after they start to feel better, continue to wear a mask, continue to make sure that you're distancing, because we now are starting to see that there's actually quite a bit of time that people still have some virus and might be able to spread that.
How does whatever's being developed in terms of vaccines compare with what people are familiar with, and that is like polio and measles? When we're vaccinated as children, it's a vaccine that lasts typically a lifetime.
Right.
The virus or whatever is causing those diseases doesn't change over decades.
Right.
What's the difference between the vaccines that we're familiar with and what vaccines might be developed now?
Right. Well, what we have right now is a virus that is probably changing a little bit more frequently than some of those other viruses that like polio and things like that. It's been shown that a lot of those diseases don't seem to change very much over time, and therefore when we have a vaccine that is given for those, we can have protection that goes for years and years and years. And that really varies though. Some of our other vaccines, we need to get a booster, right? And people are familiar with that concept of needing a booster every few years. And that's because for that particular organism, the immune response doesn't seem to be as long lasting. So it really just varies from pathogen to pathogen, what kind of an immune response there is, how much of a response is needed for protection. It's just so different for each organism that it's really something that this is why it's so critical that we're doing all of these clinical trials right now, because we just won't know. We can't really say, well, just because this worked in this other virus. I mean, we now have data that we're starting to see even some things that we learned about very, very similar viruses like those that cause SARS and MERS don't necessarily hold true for this novel coronavirus. So we're just gonna need that testing, and we're gonna need to wait and get those results back. And we can't really say just because we saw something in another virus or a similar virus, that's gonna also be the case for this novel coronavirus.
We're with Dr. Matthew Badtke from Jackson College, and we'll be back with more from Dr. Badtke right after this quick break.
I've been a Kelly Express Smart customer for years, and there's a simple reason why. I stop at my Kelly Express Smart every day when I take my kids to school and go off to work. The entire staff is friendly, and the manager even saves me my favorite morning paper. The service is always fast, which is great for a family on the go. Kelly Express Smart has everything my family and I'll need to get our day started, especially fresh, hot coffee. There are locations all around Jackson, so I know that there are quality products and fast, friendly service just around the corner. Kelly Express Smart, they're the best.
Why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
So we're asking everyone to be selfless for others so that we can protect those who are most susceptible.
Not going to bars, not going to restaurants. It all just means physical separation so that you have a space between you and others.
For more information on how you can social distance, please go to coronavirus.gov.
The coronavirus pandemic is an incredibly trying time, but we're here to remind you that there is light at the end of this tunnel.
King David writes in Psalm 30 and says that weeping may last for the night, but joy comes in the morning. We have hope that joy is on the way. We just have to keep fighting.
I'm proud of the way so many of you are serving this community. Keep going, Mid-Michigan. We'll make it through together.
JTV Studios is your local source for high-quality video content. Whether you're looking for a touching testimonial, an exciting commercial, a fun educational film, or a useful safety video, JTV Studios can create engaging content at competitive pricing. We've already helped dozens of businesses, big and small, to train, promote, and grow. And we can do the same for you. Call or visit us online for an estimate today.
Are you and your parents ready for their retirement solution? Bring mom and dad and visit Brooklyn Living Center for a tour and complimentary lunch. Brooklyn Living Center, set in the Irish Hills, has ground floor apartments, spacious floor plans, home-style meals, 24/7 staffing, and much more. When mom and dad move to Brooklyn Living Center, everyone will be worry-free. Brooklyn Living Center is a Lloyd Ganton community where our continuum of care spans all levels. Call now for a tour.
Welcome back to the morning show. We're with Dr. Matthew Badtke, Science Chair from Jackson College. And Matt, I want to ask you, the governor started to open some regions, the UP and then the Greater Traverse City region, multiple county regions. From a public health perspective, I want to get your insight on opening just those regions and then maybe going county to county and right. If you think that's kind of how we should be opening the state.
Right, I think it makes a lot of sense to not have a one-size-fits-all approach to opening things back up. And I think that when you have such differences like we have in the state of Michigan, where you have some counties that have, single-digit cases, and then you have other regions like the Metro Detroit area where you've seen so many cases, trying to have one policy that goes for the whole state, it doesn't make a lot of sense. So I think from a public health standpoint and from an economic standpoint, it makes a lot of sense to look region by region and say, are there areas where we can open things up a little bit sooner because we've seen a lower number of cases, we haven't seen the influx overall. So I think that's a good approach to, and whether it will end up going county by county or just region by region, I think that's a good idea. One thing people do need to keep in mind is that some of those areas that people are saying, well, why haven't we opened these areas up? There's very few cases. These are also the areas that are probably least equipped to deal with a large number of folks being very sick, needing to go to the hospital, needing ventilators, things like this. They don't have the supplies like some of the other larger areas in the southern part of the state. So there's just something that people need to keep in mind, is that these are areas that, yes, they do have less cases, but they're also not as well equipped to handle a high number of cases. So let's hope that people continue to follow the distancing guidelines, masks, all these sorts of things that we've been talking about over the last few weeks. Because as you start to open these businesses up, as you have an influx of people coming from the southern part of the state where we know we have a higher number of cases, we certainly have the potential for spread there. So people need to remain cautious, but I think it's a good approach. I think at some point we absolutely need to start opening things up as much as we can in order to get the economic activity going again.
So we had all this news about the development of the vaccines, and the other thing that is being worked on is treatment. Right. And and I think we've heard so much more this past week about various medicines and treatment methods, antibodies. What's the status really of any kind of effective treatment?
I think it still remains very much a wait and see approach. I think despite new information about, this drug might have an effect, or this drug might do something, or this had an effect when we looked in an animal model, or this had an effect when we looked in a cellular model, or whatever, there's still very little data in people that shows that there really is really anything that has much of an effect. So the hydroxychloroquine and things like that people have been talking about, I just saw a study that I think somewhere in Europe, there are a lot of folks that were taking that drug before COVID-19 started, and they looked to see whether there was any sort of protective effect, whether those people that were already taking that drug were protected from getting infection, and the answer was no, they were not. There was no difference in protecting them from getting infected. And that makes sense because those drugs are usually sort of an immune modulator, so they kind of damp down the immune response. So it makes sense that wouldn't really stop from infection. Now, whether there's any impact, we haven't really seen that yet. I haven't seen any data that suggests there's really a big impact on course of disease, on anything like that. But there's a lot of studies underway. And so I will just say, for all these things, we just have to wait until we get the clinical trial data. Those are the studies that we look to for a reason. It's because they're done in a manner that really allows us to answer the question of, does this treatment or does this vaccine actually work? And so unfortunately it takes time, but we do get an answer at the end, yes or no, is this going to show a difference or is it not?
So I'm curious, going back to the polio vaccine, we had no internet, the communication was, and the science while we have had vaccines for centuries, that was able to be distributed, it sounds like relatively quickly. Can you give us a little bit of the history from the development of the vaccine by Dr. Salk to getting widespread mass inoculations?
Well, I know that was a clinical trial, very similar to how we would do a clinical trial nowadays. They actually took a whole bunch of different cities around the country, and some of the cities got the actual polio vaccine, others did not. And then they looked to see what happened with rates of infection. So it was a very large study that was done, and they saw an effect, saw that it was protective. And as far as the actual, process, there was a lot of push to manufacture a vaccine, and we had, I don't know exactly how long it took to get that capacity up, but it certainly was something that you're right, but it probably took on the order of years to start getting that rolled out. And so this is something, there's a lot of interest right now in people thinking about what is the strategy, who is the highest priority. Let's say there is a vaccine, everybody's hoping that there is going to be one, maybe by early next year. If that's the case, and we can, let's say we can make, 10 million doses a week or something, who gets it, right? It's going to take a while for everybody to get vaccinated. So who's the most important? Is it folks that are in the higher risk category? Is it folks who are healthcare workers? I think most of us would agree that there certainly are some folks that probably should be getting it before others. So how do we figure that out, right? And if that's developed in Europe or the United States, then is that the country that gets it first? Do we share that information so then we can have manufacturers all around the world that are making a vaccine in the same mechanism? Just don't know. We just don't know how this is all going to play out, but it's something that people are really interested in, is how do we actually get doses of a drug or a vaccine or whatever out to the people who need it most.
Before we run, I want to tell people a little bit about your Bio 140 Public Health class and talk a little bit about that as we wrap up today. Yeah,
so we are going to be, I think we've got 3 sections of the course that are going to be running this summer, and it's going to be heavily focused on the novel coronavirus and COVID-19. I'm redesigning things right now as we speak to kind of get that ready to go for this summer. And we've got, like I said, courses that are going to be starting in June. We've got some that are going to be starting in July. And so I would just encourage folks, if they're interested, you can email me directly, or you can go to our website, jccmi.edu. And it's pretty easy to get registered and signed up there. I think it's going to be really interesting. I'm looking forward to the discussions amongst the students because I know there's going to be a lot of interest in what's going on right now.
Yeah, this is going to be your public health curriculum for years.
I think so. I think you're right. Yep.
And really, it's going to be a story. It's just going to be. This is years. We're in it for years.
Yep, I think so. I think you're right.
So as we've talked about the opening up, and we know there are people that are packing their cars to go to the
Absolutely.
Upper Peninsula.
Right.
What precautions, what suggestions do you have for people as we get into the 80s temperature-wise this week?
Right.
Summer's here.
Right. Well, you know, as we've talked about before, I think outdoors activities are probably okay, especially if you're not spending extended periods of time very close to other people. I think that's fine. So if you're, you know, hiking or outside boating or things like that, where you don't have a lot of other people that you're coming in close contact with, I think that's going to be fine. If you do have things that are indoors or when you're going to be around larger groups of people, try to maintain that distance, try to wear a mask if possible. You know, the data shows that wearing a mask really does, I saw this week, 75% decrease in transmission in China when they looked at areas that people were wearing masks versus where they weren't. So that's a significant change. So try to wear a mask, try to maintain that distance as much as possible, but worry more about the indoor stuff than the outdoor stuff. I think that makes a lot of sense. Great
advice. And as always, a lot of wonderful information, very helpful to us. Thanks for coming in again today.
Happy to be here.
The chair of the science department at Jackson College, professor of biology and chemistry, Dr. Matthew Badtke. Stay tuned. Up next, Pat Willis from the